trend, and especially here in Kirinyaga County, when we see people killing themselves. There are rape cases, and there's a lot of stealing that is happening, from farm produce to cash crops. And I think it is important to note that issues to do with mental health are real. So I am appealing and calling upon individuals, family members, community to ensure that if there are changes in behavior of our family members and our friends, let us take action, let us speak to them, let us take them to hospital, because mental health is illness. Mental health is not a condition that will just go away. It is a condition that can be treated. And I want to tell members of the public that with the Social Health Authority, we have a package for mental health, can be taken care of at the primary health care, and it would be important for the community to take this up seriously. It's in the kiosks, then let the food handlers also have the food handlers must have inspection certificates. We're actually in the Christmas period. We are in the festivities season and mood. And my plea to the members of public is to ensure that foodborne diseases do not occur in our families, in our communities, in our household. And how does foodborne diseases come? You will get a foodborne disease out of eating contaminated food, out of eating meat that is not inspected and it is contaminated, out of eating leftover foods, food that is not heated or is not boiled, or eating food that is uncooked. Therefore, I want to implore to the members of public, ensure that is the highest level of hygiene at any given time in our households. The surfaces where we are preparing the food, they must be cleaned. We must ensure that we wash our hands, that we make the compound clean. And as we travel from one place to the other, please make sure, if you are a driver, do not drive when you are intoxicated, when you are drunk. Do not drink and drive. Do not drive in a speed that is not recommended. Ensure that you're safe on the road and you're keeping your passengers safe. Our children are home. Introduction of drugs and substance use could be on the rise right now. Make sure we protect our children, our young ones who need to go back to school in January, and including the young people who are in the universities and those who are also coming from towns and coming to the villages. Let us practice good behavior. HIV and AIDS is rampant, and do not forget or do not think that sexually transmitted diseases have gone on a break. You will still get sexually transmitted diseases if you have unprotected sex or with partners who you do not know. It would be important that we protect ourselves. If you must do it, then use a condom. Or if you must do it, use protection.
We have had a number of cases, the suicide cases, especially affecting either men or young children, or young people rather, for that matter, young people. So I don't know what would be the scientific explanation to that. I'm challenging the church. Let us come out and support these people before it is too late. Let us not only appear when they are dead, when they're being buried, but even when they are alive, we can save them by listening to them. And number two, even the government, the other structures that we have in the society, let us come out clearly and support them, because it might be too late and we might now have no generation at all. If this number of suicide cases increase so much, we may not have anybody to preach to, nobody to govern. So I blame it mainly on the social structures, the systems that are there. We need to come out clearly and see what is happening. Number two, I also blame drugs and substance abuse. Drugs and substance abuse, especially Bangi. This area has a lot of miraa. A lot of people are growing miraa. People are selling miraa and mogoka. And as a result, people end up beginning to chew this drug at a very early age. And when they grow old, they kind of graduate into the hard drugs. I wish that was going to be taken care of. Let the government come in place and maybe stop the spread and the usage of drugs and substance abuse, and also alcohol in this area. For me, these are the main areas that maybe contribute greatly to the suicide case that we have on the rise in this area. That's my take. The sharing of the word of God. I'm challenging the men especially to come out. Let us not hibernate. Let us not hide in the drugs and alcohol. Let us come out and share. I'm sure there is somebody somewhere who is ready to listen to them. Let them come to the church and ask to be listened to. Otherwise, women have an upper hand because they have their own social gatherings and groups that they go and vent whatever is in their heart. But for men, I am appealing to men. Come out, talk what is in your heart. Ongea ikutoke. Talk whatever is troubling you. Have those social circles, not only to drink and to count dowry, but also to open up, and maybe we can save one or two people if only we came out clearly and shared our stories, because there are many people who are willing to listen if only we are willing to talk.